Did Helm?
Here we go.
Hi, everybody. I am Cheryl Jackson, and I'm excited about being here today. And we have our virtual town hall today talking with the experts from the Maryland Department of Health. And I'm excited about doing this interview because you hear me say it all the time. You hear our announcers say it all the time on all of our stations and all of our platforms. But just in case you don't think we know what we're talking about, we brought the experts today to tell you exactly, to reiterate what we've been sharing and just the practical tips of doing the things that they've asked us to do, like wearing our mask. I usually will have my mask on, right? But I'm home, so I'm good. Wear your mask, wash your hands frequently, social distance. And, that really is helping us. So I really want to talk about that and the practical things that we need to do. I want to be able to answer your questions. So if you have questions, be sure to share them on your platform so that we can share it with our experts and they can answer them. Also, share this. Tell everybody about it. Share it. Post it on your page. Tell everybody to join us tonight. We are so excited about being here with the experts from the Maryland Department of Health. So we'll get started by introducing our guests tonight. Dr. Clifford Mitchell, he's the Director of Environmental Health of the Environmental Health Bureau, Prevention and Health Promotions Administration for the Maryland Department of Health. And he is our comedian tonight. Like he had laughing backstage before we got started. But I'm so excited about having him. Welcome, Dr. Mitchell. How are you?
Thanks very much, Cheryl. It's nice to be here. And that's a tall order. Now I have to be funny, which you're not happy.
Just be you, because that's who you are. But talk a little bit about what you do. Give us your background a little bit and tell us what you do at the Maryland Department of Health.
Sure, because most people don't know what the Environmental Health Bureau is. So we're the bureau that regulates things like food and restaurants across the state. We also do a bunch of things like summer camps, youth camps. We regulate those, swimming pools. We have a program in violence and injury prevention, in rape prevention education, and some programs on things like climate change, asthma, and lead. So we are I'd like to think of us as a small but mighty bureau, but our real focus is on keeping people safe from physical hazards in the environment and things like foodborne disease, along with our infectious disease colleagues. For COVID, for a variety of reasons that nobody understands, I am the person who is responsible in the state for business, environment, higher education, and correctional institutions. So a lot of that has to do with the fact that as a physician, I deal with some of those things in my regular day life. And so that's what I'm doing for COVID.
That's amazing. I have 2 children in college at the same time.
And you're on mute, I believe, Cheryl.
Am I on mute? So okay. I have 2 children in college right now, so I know that you've been the one that's regulating what's happening on these Maryland campuses. And so good to meet you. Thank you for coming and thank you for sharing tonight. We have so much to jump into. Dr. Catherine Feldman is also with us. She's the Director of the Contact Tracing Unit and Chief Public Health Scientist at the Maryland Department of Health. Welcome, Dr. Feldman. Tell us what you do as well.
Sure. I'm so glad to be here. So thank you very much for this opportunity. I am the Director of the Contact Tracing Unit at the State Health Department. And what that means is we help with the contact tracing efforts, which I hope to tell you some about tonight, across the state. And so this is a large coordinated effort that is being done to help stop the spread of COVID in the community. So that's my current day job now. My background, fun fact, is I'm a public health veterinarian. So my background is in veterinary medicine as well as in public health and infectious disease epidemiology. So looking at disease patterns in the population with a particular interest in the intersection of animals and human health.
Wonderful, wonderful. So usually I have to fight off my puppy. So he's a big puppy. So you would have appreciated that had I allowed her to come in tonight.
It would be nice to meet her.
All right. Also, we have Jonathan Weinstein. He's the director for the Maryland COVID-19 Testing Task Force. And so he's with us tonight as well. How are you?
I'm doing great, Cheryl. Thank you so much for having us.
Good. Now tell us what you do.
So my role as the director for the testing task force is just as it sounds. So My team of folks help coordinate and implement testing across the state in a lot of different ways. We do it by operating state-run testing facilities. Our two biggest are at Six Flags and in Annapolis. We partner with other organizations like Johns Hopkins and the University of Maryland to operate the Baltimore Convention Center site, and then support local health departments in their efforts to perform testing at their level by providing tests. We're shipping out rapid antigen tests all over the state right now. And we're also just fielding any sort of questions, concerns from our partners all around the state regarding testing and doing things that we can to help them.
I want to jump right in. We want to start with the basics, just in case people don't know what COVID-19 really is. And I know that the 19 stands for the fact that it was established in 2019, but give us what COVID-19 is.
Sure. So I'll start, and then we can do a round robin. So COVID-19, it's a disease that's caused by a virus, the SARS-CoV-2 virus. And this is a virus, and actually this is a good question for me because it probably originated from animals. And so the virus hopped from bats, maybe through another animal, to infect people. It's a respiratory virus, meaning that people can get it through respiratory transmission. So somebody breathes out the virus particles and the next person can get it. And it causes disease in the respiratory tract. Of course, it can cause disease in the body even beyond the respiratory tract, and it can cause very severe disease.
I see. Did anybody else want to chime in and talk about the basics of what COVID-19 is?
Nope. I think that summed it up. And the only other thing I would say, and I agree with Dr. Feldman about this, is, this class of viruses that jumps from animals to human, although we haven't seen it before, it is interesting because we know it has a tendency, like all viruses, it'll mutate to some degree over time. So one of the things that we have been waiting for and will continue to watch for is the idea that at some point or another, it isn't going to simply just go away if we have vaccine. It'll probably still circulate to some extent. And one of the things, just like regular influenza, that we'll have to watch for is the chance that it mutates so that it is no longer completely resistant to the vaccine or the antibodies that the vaccine makes.
Yeah, because like the flu, there's different strands of it, right? And different strands could develop. Is this what you're talking about when you're saying mutate, right?
Exactly.
Wow. So with that, and this is also why we find people who have respiratory issues or pre-existing conditions, it attacking them a lot worse than those who may not have those different respiratory issues, right?
Correct. Whether you have a severe reaction does seem to depend on a whole bunch of different factors, but there's no question people with underlying disease, especially lung disease, but other kinds of disease as well, are definitely susceptible. One of the things we don't know and will learn only with time is there also seem to be some late complications of the disease, even for people who recover. So we've been looking carefully and don't yet understand completely what happens. Some of the reaction is the reaction to the disease itself, the infection itself, but some of it seems to be the body's own defense also causes some kinds of reactions. And so you hear people talk about this idea of changes, this brain fog that people have talked about much after the disease, where they have trouble concentrating and focusing. We don't really understand everything about that. And then for children, the idea of this multi-system autoimmune inflammatory disease or syndrome is something that is probably a result of the body's own defenses going a little bit haywire and sort of overreacting in response to the infection. So it can cause problems a whole bunch of different ways.
Wow. And I'm probably thinking the treatment as well, right? So sometimes you'll get the effects from the actual treatments.
Yeah, so Cheryl, I was going to highlight a point that Cliff mentioned. This is a new disease. So we still don't know all of the possible outcomes for this disease or the long-term consequences. And so, every day we learn a little bit more, but it might take a lot more time to figure out all the ways this disease can wreak havoc.
Mm.
And Cheryl, one thing I'd add, especially what Catherine just said, is the message that some people should take from this is patience, right? Because we are learning something new every day, not only about the disease, but about how to more effectively test. We have a vaccine now that's going to be coming out, and even while we're rolling that out, we'll be learning things from that rollout. So my sense is, and from a testing perspective, one of the things I'm really concerned about is people being impatient with sort of how long this has been going on, and maybe not following the guidance so much, or not seeking out tests when they should. Is that patience? We are working our way through it. The vaccines present a light at the end of the tunnel, but this tunnel is a long one, and that light is still months away. And so we really need patience, understanding that our medical community is still working on and sharing. People should listen to experts like Catherine and Clifford,
Right.
and really take the time and be a little patient.
Got it. So Wilhelmina Collins is asking, how does it differ from other respiratory viruses when it comes to, infecting folks? Because, we have other viruses that are respiratory. How is this one different?
So one of the ways that it differs is that we haven't seen it before. So remember that when you are born, as soon as you're born, even before you're born, but when you are born, you start inhaling viruses all the time.
Mm-hmm.
And we live in a sea of virus particles. Mm-hmm. But one of the things that happens is our immune system learns, because it's been exposed to these before, it develops natural immunity, so that when you're exposed to the virus that your body has seen before, you have this whole defense mechanism that's in place to protect you. Mm-hmm. The problem with coronavirus, with this novel coronavirus, is that no one has ever seen this before, so there is no immunity in anybody to it. And so when the virus starts to reproduce in your system, there is no memory of that virus ever having been there before, and your body's defenses don't really know what to do right away. That gives the virus time to reproduce itself and cause more serious damage.
Now, we talk about people. I've heard people say the virus is airborne. You could get it only by touching surfaces. You've heard so many different things. So how does COVID-19 spread?
Well, do you want to talk about the animals first, Catherine, and then we can go to the people?
No.
No.
We'll let you talk. The people are the big concern, and so this is a good opportunity to say that with the virus coming from animals, originally there's concern then about people's pets and it's spreading in animals, and there's certainly a need to keep an eye on it. This is a new virus. We need to understand all of the potential ways that it can be transmitted, but the real concern here is person-to-person spread. And so it's when people breathe and they spread the virus particles in the environment, and those land on other people, they're inhaled by other people, that they can cause disease. So that's the biggest way that you can get it, is that close contact between two people, one person breathing the virus out, the other person breathing the virus in.
Right. And so we don't know everything about this virus, but one of the things we probably know at this point is the more viral particles you're exposed to, the bigger the chances are that you're going to be infected. So we know the longer you're in contact with somebody at close quarters, the more likely you are to get infected if that person is breathing out, exhaling these viral particles. So you mentioned what about things that you touch? Mm-hmm. And so the respiratory droplets that we all give out when we breathe are of different sizes. Some of them are very, very small, and they sort of stay airborne for a while. Some of them are a lot larger, and they are, everything all the way up to when you see somebody exercising and you're seeing these droplets fly out and hit the floor.
Nice.
Yeah, that never happened to me, but I'm just saying, other people, it's rumored that happens. Yeah. So I also glow, by the way, just so we're clear. I don't actually sweat. But okay. Other people, it is alleged, they can emit these large respiratory droplets. These respiratory droplets, if they are in fact exhaled, are full of virus. So really the big concern, as Dr. Feldman said, is absolutely being in close contact with somebody who's breathing out these particles, and you're in their breathing zone or close to it within 6 feet. That is the most dangerous part of this. You can, in some circumstances, get this by picking up picking up particles from a contaminated surface. But I do want to emphasize, the reason that we emphasize regular cleaning is these particles, these viruses are not magic. They're not indestructible. They behave like other viruses, and they will die. They die with bright sunlight. They die with even dilute bleach. They die with approved cleaners that are on the EPA registered cleaner list, as long as you leave them in contact with it a sufficient amount of time. So they don't behave any way differently than other viruses. So if you're doing regular cleaning, if you're washing off your fruits and vegetables and your food, that's not the big concern. The big concern really is that particle where you're inhaling it from somebody who's directly in front of you. And that's the reason we put all this emphasis on social distancing.
And masks.
So that's what we'll get into, some of the things that we can do to help slow the spread. Again, I know that our viewers hear myself and all other announcers on our station and across the state of Maryland, across the nation, talking about these practical things. And I know it just sounds so simple because, like I said earlier, because it's so simple, people just think, that's just too practical. I wash my hands all the time. I know we have to wear these masks. You have the whole group of people who are like angry about having to wear the mask. I like to find them fashionable. Yeah. We have to find some kind of creative ways to do, mine are going to be blinged, so that we can find some creative ways to make sure that, this is not a gloom and doom situation. Like it's our new normal. So we might as well get used to doing it. So let's get into it. Let's talk about some things that we can do to help slow the spread.
Well, I'll jump in here because this is the thing I like to say to keep people from coming to our test sites, right? Is if they're doing those critical things, wearing the mask, right? The physical distancing. We've talked about washing hands, cleaning surfaces, but I just want to dispel a rumor, and unfortunately, we have heard from people who are in leadership in places around the country say masks don't work. They're just plain wrong. We've rarely had a situation where something so simple, so easy to acquire or even make on your own can prevent something so tragic. And anybody to diminish that, I think, is doing a huge disservice to the community. So it is that practical part of doing masks, wearing masks at all times. And it's not as big an inconvenience. A lot of us are getting used to it, but that's a key thing. I think the distancing part is certainly what we've talked about as well. Gatherings, we have taken steps here in Maryland and around the country. You've seen gatherings that we started really stay in your homes to no more than 5 or 10 people to 25 to 50. Now we're going back the other way. I think in LA just yesterday, they told everybody stay home for, I think it's 4 weeks. My son lives out there and he's hunkered down, so if we do these other simple things, the more dramatic things, more drastic things, it won't be as necessary here. And I'm proud to say that Marylanders tend to be on the high end of the compliance with these critical things. The other thing I would say practically this time of year, particularly over the last couple of weeks and for the next few weeks, is really to limit travel. It should be only essential travel. This is a horrible time to tell people they shouldn't be going out and about and visiting with family with all the holidays that are present. And Thanksgiving is my absolute favorite holiday. But you just have to think about it on the other side. It only takes one person who's infected, may not even know it, to be in a place small and closed over a dinner table, and then we've heard about those horrible situations like weddings and other gatherings where the repercussions have been tragic. So I think those are just some things we need to all take into consideration.
That's a great question we have here. Are the fashion masks less non-effective? Because if mine is bling, I'm probably still wearing a surgical one underneath. Because
Right. So
yeah,
no, that's a really, really good point. So the thing that makes the mask less effective is if it's got big holes in it, or if it doesn't fit very well. Those are things that will make it less effective. If it's the sort of things that you want to look for from a practical point of view, can you see through it? If you can see through it, that's not really good. They should be, which is not saying wear it around your eyes, but it's still where you want to wear it is on your mouth, and it should cover your mouth and your nose. Ear loops are work okay. Some of the better ones are one sort of on top of the head and around the neck. But the other thing about those masks is a lot of people are still wearing their sort of neck gaiters. And unfortunately, those don't actually work very well. So while a lot of people are wearing those neck gaiters, we are generally not encouraging people to wear those. Instead, we're encouraging them to wear masks that are fitted around the ears or around the head.
You hear my
I think I heard the puppy. Yeah.
I think we heard that. Yep. I'm not a veterinarian, but I recognize that as a dog.
Great.
Good at things like that.
Good job, Dr. Mitchell. So I think one final thing about the mask is double layers. So Dr. Mitchell was talking about the neck gaiters. If you could double up the layers, I think that's generally a better approach to preventing transmission. And one thing that John mentioned that's really important is it may be as many as half of the infected people who aren't showing signs and able to transmit. So you can look and appear well and be transmitting virus.
Right.
And that's really important to understand. And so it's important to always wear your mask when you're out and about, not just if you don't feel well.
Mm-hmm.
Yeah.
That's the scary part.
Point to gather here is when you're wearing a mask, you're protecting other people. It's as much to protect you as it is everybody else. And so, I was actually talking to my own primary care physician the other day, and she said, it's just a nice thing to do, right? It shows that you care about yourself, you care about others. And I think, we're trying to make sure that it's not just a government mandate, these evil government people telling you you can't do certain things. You live in a neighborhood, you have neighbors, you have friends, you have family. You're doing everybody a service, showing people that you love and respect them by doing that. The only thing I'd say about the bling, Cheryl, I just warn you, be careful of the rhinestones and inhaling them, right? Just somebody knows the Heimlich maneuver.
Nothing like a safety tip from a professional, I always say. That's really
call me an expert.
Good to know that people are on top of
the
that.
Outside of the mask.
Well, I don't know if you have rivets and all that, so you don't want to have bling that's piercing the mask. So
I'm afraid John's going to have to own this one all by himself. I'm not going to comment on the rhinestones. I'm just saying. But for George's question about flu shots, I really cannot emphasize enough how important it is to get a flu shot.
Right.
This every year is important. This year it is critically important to get a flu shot. There are a whole bunch of reasons why, but the big ones are, first of all, if you're sick, we don't necessarily know whether you've got the flu or COVID-19 because they can be very similar. So if you can prevent the flu from taking place, you are not only reducing risk to yourself, you are decreasing the number of people who could potentially have to go to the doctor or the hospital, and that's saving you some time. It's saving you safer because you don't have to go into the hospital, and it's safer for everybody else because it decreases the number of people who may have the flu who end up needing medical care. So absolutely get a flu shot.
Got mine yesterday. It still hurts a little bit.
Great question, George May. But yeah, it doesn't prevent COVID. But you
does not prevent COVID that we are aware of.
Yeah. But you should get it for the reasons that Dr. Mitchell said. All right, let's get rolling because we got to get through these questions. So who should get tested for COVID-19? I know we talked about those that are asymptomatic, those that are symptomatic. And do we have enough to go around? I know our governor, worked really hard at making sure we have, tests, at mass amounts. But who should get tested?
So I think this is John's department.
This is yeah. And so I'll go through my mantra here. So anybody who needs a test can get a test. I mean, we have over 230 sites across the country. Sorry, across the state that are available, and we have a website. If you go to the website that you showed earlier, there's a testing tab. You just have to click on testing. There's a map. You can put in your address and find a number of sites closest to you. And so the who part is really, if you have symptoms, you should get tested. If you've been exposed to somebody that has tested positive, you should get tested. If you're, as much as I hate to suggest this, but if you're planning on traveling and being with loved ones during this holiday season, you should get tested. And I think
before and after, right? Before
and after. And so there's an excellent point, Cheryl. In terms of before, you need to get a test before enough time so you get the results. I hate to even say this, but I know a couple of specific people in instances where they got tested, didn't get the result, and got on a plane, arrived where they were going to find out that they were positive.
Wow.
That is just insane. So that aside, you need to get tested before. Wait for your result before you make any decisions of going. And then when you come back, the governor, just relative to travel, I mean, he's put in that, a travel advisory, and it's very clear. And it's laid out basically: get tested, quarantine if you've been to certain places. Mm-hmm. And people who, I would say, people who have no reason to get tested. They're not symptomatic. They haven't been exposed, and they've been basically following the rules. It's there. Those are folks who don't necessarily need to get tested. But if you're in a job, you work in a grocery store, things like that, where you're around a lot of folks, every once in a while, it probably pays to go and get tested. In terms of your question about the availability, there isn't, for the PCR test, which is sort of the gold standard. There are no challenges with availability for that.
Let's talk, John, for a minute about timing of the test, because people sometimes have a question about
that. That's a good point. Yeah, I mean, we in terms of the time before and after, did you want to talk about that, Cliff?
Yeah, so it's important to understand how the virus behaves in your body, because that helps understand when the best time to get a test is. Right. Mm-hmm. So if you're exposed to somebody with the virus, you inhale a bunch of virus, it does not immediately become detectable in you. It takes several days on average, if you have been infected, before there's enough virus for you to either A, have symptoms, or B, have a positive test. Mm-hmm. So let's suppose that you get you get notified that, and Catherine can talk about this, and including the notification, but let's suppose that you get notified that you have been exposed to somebody who is in fact infected. When would the best time to be tested be? Well, first of all, if you develop symptoms, you should get tested as soon as possible, no matter when that is. So that if you develop symptoms, then you really want to get tested right away, because that helps get you to a point where you can remove yourself and not expose other people. But if you don't have symptoms, then generally speaking, you don't want to test yourself immediately after exposure. On average, probably 2 to 5 days, somewhere in that region, is where the test is most likely to be positive. And it's certainly not before 2 days that you want to get that test. And Catherine, did you want to talk about the sort of contact tracing part of that story in terms of the notification, and then when to test and when you're recommending testing?
Sure. So what Dr. Mitchell's talking about with contact tracing is, if somebody tests positive, they go to a test site, they get that positive test result. That test result gets reported to the state health department. And that's true of many different kinds of tests. But COVID tests get reported to the state health department. So that positive test is going to flow to the state health department and then trigger a call from a contact tracer. And the contact tracer is going to call and check in on you, make sure you know that you have the positive test result, check to find out how your symptoms are doing, and then give you advice to isolate, stay at home until you are no longer infectious, and make sure you have the resources to do that. Also, part of that conversation is going to be asking who you might have exposed. So this is where we're trying to figure out where that in the period before you knew you were infectious, or before you started showing symptoms, who you might have transmitted it to. And that's where we get the names of contacts. And we ask people to share the names of contacts. It's really important to do that, because we can provide guidance. We can have this kind of conversation we're having now and tell you how many days after that exposure you should get tested and the symptoms to look out for. So we ask people to please share the name of contacts. Sometimes that sounds a little scary when we call up and we ask for that, but we really want people to know it's because we want to provide information, give resources, make sure you know what to do next.
Right. And that's so important, because that was one of the questions we had. What should you do if you tested positive for COVID-19? And I have a short story, because, when we were allowed to have at least 50% people into our churches, people were still, having services, and some are even having full capacity,
Mm-hmm.
I'm going to go into that, but how wrong that is. But when we were doing that, there was a sister who had tested positive, but came to church. And she felt like it was fine because she had her mask on. She was asymptomatic. She wasn't, feeling the symptoms, but it spread it. So then there were other members in the church that also contracted the virus,
right?
Took it home. And
right.
And other family members who maybe not even attended the service. So it can be a whole snowball effect of things. So stay home if you test positive.
And your story is so perfect, because you said she was wearing a mask. So it goes to show you that you take these precautions and it's going to reduce transmission. Mm-hmm. But if somebody is positive, the best thing they can do is keep themselves apart from everyone else. And we know it's hard. And that's one of the reasons when the contact tracers call, they're going to be checking in and making sure you can do it, making sure you have the place to do it, making sure you have people bringing you food and taking care of you, but at the same time, staying safe. Mm-hmm. So your story is a perfect cautionary tale of why it's so important for people to isolate and stay at home when they find out they have that positive test, and why it's important to share the names of the people they might have exposed. And so that gets back to what we were talking about at the very beginning of the conversation, who is considered a close contact. And it's people who are within 6 feet of you and have spent more than 15 minutes with you. And your story also really nicely illustrates why that definition, it doesn't matter if you're wearing a mask or not. Mm-hmm. It's that within 6 feet for at least 15 minutes, we need the names of all of those people so we can make sure they get the guidance they need. And back to the question that we were talking about, when is the best time to get tested? They get the information about testing and about quarantine.
Here's a question on our screen, if anyone wants to address it.
Macy's question.
Yeah. Macy says, if you've been tested, if you've been positive, this is for all those who may not see her question from another station. If you've been positive for the virus, what's your risk of others after quarantine and recovery? And can you carry someone else's droplets to someone else?
So the answer to that is we've got a pretty good body of evidence at this point from studies both internationally here in the United States as well, that once you are over the recommended time that the CDC has recommended in terms of infection, which is ordinarily right now 10 days. And the things that we look for are, first of all, has it been at least 10 days since either your test was positive, that is to say the day you took the test, or that 10 days since you developed symptoms, which is the day that you first started having problems. Mm-hmm. If it's been 10 days and your symptoms are improved, they don't have to be completely gone. Sometimes people will have a cough for a while afterwards, mm-hmm. but your symptoms should be largely improved. You're fever-free, at least for 24 hours, without the use of any kind of Tylenol or any other kind of medicine. The chances that you are going to infect somebody else are pretty much, they're essentially zero. They're not completely zero, but they're so close to zero that you've been released from isolation, you're okay to go. Now, some people, especially if they've got underlying immune problems, they have cancer and are getting chemotherapy, they've got diabetes, or they've got some other autoimmune condition, they may have more serious disease. They may take longer to clear the infection. And for those people, their doctors may recommend that they stay out of circulation for longer than 10 days. But for somebody who's generally otherwise healthy, their symptoms are improved, they're fever-free at least for a day, at least 24 hours off of medication, and it's been at least 10 days, their chances of infecting other people are so low that essentially we say it's okay to go back into circulation. But they have to continue wearing a mask because we recommend that for everybody. They have to practice social distancing. We want them to keep on doing all of those other things. Those are really important things to do.
Awesome.
Catherine, this is yours.
This is mine. Okay, so how far back in time do you go for contact tracing? So you get that.
I had another question that I see on our Facebook page from Karen Jackson. It says, of course, from the scenario of the church, and this kind of is hand in hand with contact tracing. She said, if this happens in a space like the church or a mass where mass people are, there she is. She said, how does contact tracing come in place for that too? So this kind of goes hand in hand.
Right. So, first of all, when the contact tracers call you, they're going to ask you everybody you were in close contact with from 2 days before you first had symptoms, or if you don't have symptoms, 2 days before you took the test. So you go 2 days back and then all the way to the time of the conversation to find out all the people that you've been in close contact with. Now, the church is a good example, and there are many types of situations like this, gatherings and other settings where there could be large numbers of people that are moving here and there, to and fro, and it can be hard to figure out everybody that you were in close contact with. So this is why it's so critical to do the social distancing and try to keep that 6 feet apart. So if we're in a church setting or a church situation, then what's going to happen is the local health department's going to call and as part of the contact tracing process and try to understand the situation. And you're going to try to use all kinds of tools to understand who was at church that day, who was sitting in close contact with you. Was there a lot of movement? Was there singing? Singing has been documented to be a reason for transmission. Of course, there's a lot of singing in churches. That's one of the reasons we go, right? So, but singing can really help spread the virus. And so if there's a lot of singing, they might be a little bit more inclusive and say, we're going to go out more than 6 feet because there were a lot of people singing and the virus could have been transmitted further. So there's going to have to be a case-by-case investigation or analysis of these kinds of situations to understand who might be considered a close contact and who needs to be given guidance for testing and quarantine.
Yeah. These are the days where you have to have your own personal worship experience right at your house.
There you go.
Yeah.
There you go.
Yeah.
Cheryl, I
don't have your own personal relationship so that you can have these virtual church services are amazing. And you really set aside time, like in our family, we could sit in our living room together like we were in church and get it. And not just in church, but small gatherings. Gatherings, people are still having birthday parties and, and I know that certain venues will allow a certain amount of people to come, but still, even though your seats are social distance, you got to still follow these guidelines, of making sure, because I know that when we were talking about Thanksgiving, we said, if you had 10 people in your home, that would be fine, but make sure, your seating arrangement is set apart. Make sure you're still wearing your mask throughout the house. So let's get into the holiday. How can I be safe this holiday season? I love that. We can be creative. I'm a creative being, so I love that we could be creative and create some new traditions. I'm a big traditionalist too. I love doing the things that we normally do, but we could create some. And my situation is a lot different too because my house is full. My college kids are home, right? My husband and I. So our house is, I'm not alone, but I do know that there are people that are alone, and they're sick and tired of this whole shutdown situation. Let's talk about the holiday season, some things that we could do safely.
Sure. So we actually put out some guidance on the holidays, and there are the things that, they do exactly what you say. We want people to enjoy the spirit of the holidays, but without the risk to themselves, to their families, to especially our older residents who have increased risk. We really want to at once recognize for their mental health and well-being and their comfort, we want to be in touch with them, but we want to do so as safely as possible. So I've heard about all kinds of things that people have been doing, the drop-by meals, Now, I will say that in some of those cases, it was the grandmother who was doing all the cooking and distributing it. So it was not necessarily that food was being delivered to her, but she was clearly doing a lot of cooking and having a lot of interaction with all of the children as they were dropping by to pick up the dinners and take them home. Those kinds of things where people really could sort of do things for one another, but not necessarily in the same place as each other, are things that will help to keep people safe. We talked a lot about, and you mentioned this yourself, having smaller gatherings with household units, with even with your own household. And we know that people did in fact travel. We encourage them to travel safely, as John said. I do want to say one thing about the holiday time, because we had a lot of concerns and questions raised about shopping and about retail. And it's tough at this time because people are also going out and buying gifts for people. And not only because of obviously the sales around this, but so many merchants and store owners are sort of feeling this year more than any other that they've got to be open, and then they've got to get customers in. And I do want to say something about this, because this is one of the things that I work on particularly. One of the things that we've heard a lot this year is that for people who are contacted by contact tracing, it may be difficult for them not to go to work because they're not necessarily encouraged to stay home by their workplace. So for all of your listeners who are business owners, we really want to encourage you, if your employees do get notified for some reason that they have been exposed, please work with them to allow them to be off. I know it's a struggle for you as a business owner, but it's really important. And it's one of the main reasons we know that people are going in some situations are feeling as though they have to work while infected or work while exposed. And we really want to encourage people. We know it's the holidays. We know people are strapped for cash. We know it's tough out there. But the only way we keep this disease from spreading is by when we're exposed and notified by Catherine's folks that we've been potentially exposed, or we've been tested positive ourselves. The thing to do is go home, take it easy, wait to get cleared, and go back out again.
And there is some good news on the quarantine front. When contact tracers call you, until yesterday, they were calling and advising you to stay home for 14 days. And the CDC just released new guidance that shortens that time. And so people who've been exposed now are told that they need to stay at home for 10 days after the exposure. And even better yet, if they can get a negative test on or after day 5 of quarantine, they can get out of quarantine after day 7. So that quarantine period's just been cut in half as long as you can get that negative test on or after day 5. And so that should help with some of the hardship that quarantine imposes on both the person who can't go out, but also the business owners who might want their employees to come in.
Sure. Sorry, I wanted to mention something back on the holiday thing. Two things. One is I'll share something that we did for Thanksgiving, and it's my favorite holiday. We usually have 20 to 30 people at our house, right? So this year it was 4, and plus 2 dogs. So all the people, all our regulars, and we have had people who've come every year for 25 or more years. We put all together a little box with our favorite side dish, the ingredients. We didn't make any because we didn't want to ship a souffle, but our favorite side dish and our favorite dessert. All the ingredients in it. We wrote little notes, and then we asked people to take pictures of it, and we called all those people on Thanksgiving to see how it tasted. We had pretty good success. We had one person who really botched the recipe, but the big surprise is my brother-in-law who lives alone, and he works in education, so his life has been turned sort of upside down, and never really cooked. But he made the best souffle out of anybody, and it was the first time he really cooked. So that was a tradition, like you're saying. We struggled to figure out a way to make it special and how we could enjoy it together. But that was one way. The one thing I would say relative to testing during this period and for people for traveling is it's important to know what I said before, get tested in enough time before you go away. But it's important to note that a negative test today doesn't mean you're not going to pick up the virus tomorrow or the next day, in between the time you have the test and get your result and you travel. It's really important that if you're going to get tested, and then in order to travel, that you do as little as you can to expose yourself. If you can if you're working from home, great. Cut down or eliminate seeing anybody between the time you have that negative test and the time you travel. So it's just another way of being more safe during the holidays. If you must travel, take real good precautions, and in that period before you go anywhere, really cut down your interactions with other people, lower the risk. If you can avoid going to the supermarket, going to stores, that sort of thing. That's just another piece of safe travel, safe holidays that we're recommending.
And if you can avoid the travel altogether, that's best of all.
We stay home. Next year is going to be even better.
We did. One of the things we did was doorstep visits. Like we go and stand at the curb. It was like, hey,
right.
Where's your mask?
Right.
Just to get out the house, we just kind of we did doorstep visits, and we was like, we knew, one of my uncles, we knew he and his wife weren't. They told us in the beginning, Thanksgiving, don't even try to come by, So we wanted to see his face, and so we stopped by, and we was like, we just come into the door, we're just gonna wave and blow kisses, and we go back, and it was so much fun. That was so much fun. So yeah, even for the holidays, people are asking. I saw that somebody asked, about swimming. Contact trace. Are you able to, contract the virus if you're in a swimming pool? So I know that chlorine will kind of kill it too. But
yeah, so this happens to be one of my favorite questions because I regulate swimming pools. So we've had a lot of questions about the swimming pools, and we've had a lot of questions about gyms too. So let me cover both of those. Mm-hmm. So swimming pools, it is still possible to transmit the virus. It's probably a little harder, but there's the way chlorine, the way the virus works. Even if you happen to be in a swimming pool, if you are next to somebody and staying there for 15 minutes or more, you still have a chance of getting the virus. Mm-hmm. So I really want to emphasize, just because there happens to be chlorine around does not protect you all the way from getting the virus. So that's one of the reasons that we changed the regulation or put out guidance to not have people swimming as crowded as they do in some pools, and to try to decrease the number of people in a lane. That's really still important because you can still transmit the virus.
Wow.
Yes. It's probably a little harder to do, but it is definitely not impossible.
Got it.
But the bigger risk is, and so this gets to the question of gyms as well. So a lot of questions have come in from us to us about people exercising on gym equipment and not wearing the masks. Mm-hmm. And I do want to emphasize, if you're working out on the gym, even a little bit, you're breathing more and you're exhaling more virus. It's really important to wear your mask. The only exception to that is if you have a medical condition of some kind or a condition that would put you at risk of serious injury by wearing the mask, then that's an exception that is allowed in the governor's orders. That's not most people. That's a relatively small number of people who have some kind of problem that keeps them from wearing a mask. So I really want to emphasize, gyms are required to enforce these orders. We expect them to enforce these orders from the governor. You should be wearing a mask in almost all situations if you are using exercise equipment.
Wow. That's good. Dave Wilner is asking, are masks needed if you're outdoors and can stay 6 feet from others?
We've got this question a whole bunch of different times, a whole bunch of different ways. I will tell you, when I'm outdoors, I'm pretty much masked all the time. And here's the reason why. If you're out in the middle of the Himalayas and you're climbing Mount Everest, you don't need a mask because you're at Mount Everest, you might actually come across some people. But most of the time, if you're walking around, you do have a chance of meeting people. And, I know there are a lot of people who sort of quickly pull up their mask when they come across somebody, and then they pull it down again, and they're going. And I understand that, and that's okay. And exercising outside is a good and healthy thing to do, and we encourage people to do it. I encourage people, and the governor's order says, if there's a reasonable chance you're going to come across somebody, wear your mask.
Mm-hmm. Wear it. Yeah.
Just wear it.
Wear it.
Make it look good.
Make it look good.
I can't do the bling myself, but
you don't have to do the bling. You could do a different color. Like,
I know what I'm getting you for Christmas.
Yeah, seriously.
you're getting him a bling mask.
yeah, that's probably not gonna. Well, it might not hurt my reputation at all in this case.
Nothing more could hurt your reputation.
That's probably true.
Now, we touched a little bit on this earlier, but Tanisha Hollingsworth is asking, can animals possibly catch coronavirus? Because, as you were saying earlier, it was derived from animals. So,
Right.
Yeah, I'll let you go ahead and address that as well.
Okay, happy to. Yeah, so there have certainly been a very limited number of cats and dogs that have had infection detected. And so it doesn't happen often, but it can happen. And so that's why it's very important if you've been, first of all, if you're tested positive, you should limit your interactions, not just with your family members. Well, I guess pets are people's family members, but all of your family members, including your puppies and your cats. And then if you are exposed to someone with COVID-19, again, it's also a good idea to limit your interaction with your furry family friends as well.
I know that there were a lot of people who were asking whether or not this was a great time to invest in a mink coat.
So what Cliff is talking about is there has been, we talked earlier about how the virus can mutate, and it looks like mink, and thankfully mink are not common household pets, but mink can get the virus. And in fact, there's a mutated virus that can cause a lot of disease in mink. And if you read about what's happening in Europe, and even a little bit in the US, it's been in the papers the past few days, there are mink farms that they're having to depopulate, horrible word, sorry, to depopulate all of the mink because of outbreaks of this mutated coronavirus, SARS-CoV-2 coronavirus in the mink populations. It's a good example of how there's so much we don't know about this virus, how it can mutate, and we need to keep our eyes open for crazy things like that to happen. Mm-hmm. So a good idea to keep Fido and Fluffy away while you're either diagnosed with COVID or in quarantine.
But I did have to break it to them that there was not going to be a glut of cheap mink coats on the market in the coming months.
There's the comedian.
Don't encourage him.
Drake is asking, should kids avoid indoor practices? And I saw another question on here about skating, like indoor skating facilities and things like that. So let's talk.
All right. So this is another thing that we've dealt with a lot. Where there are a lot of questions about. All right. There are situations where we don't encourage children necessarily to wear masks, particularly if it's really hot outside. With really young children, they can't physically wear the masks. There are other children with some conditions like asthma where they really are at risk if they have something blocking their breathing. But most children, and I really do want to emphasize this, most children over the age of 5 and over can wear a mask, and they can wear a mask while exercising. So for one of the things that we do want people to do, again, because in hockey and skating and in indoor sports, as well as outdoor sports, that physical contact, one of the places we've seen a fair number of outbreaks is in athletic teams, including student athletic teams. And so that close contact, again, where people are in a huddle or where they're coming right up to each other and they're in very close quarters, that's the recipe where you can get transmission. So by and large, unless there's a reason why children would be at risk from wearing the masks, we do want them to wear masks while exercising, whether it's indoors or outdoors.
Got it. So that goes for skating rinks, bowling alleys.
Goes for skating rinks, bowling alleys. Yes, exactly.
And, we talked a little bit about shopping. But one of the things I did notice is, because the governor has us at 50% capacity, that people were monitoring how many people were in the mall at any given time. And not only just in the mall, but then also in the store. So, so that's a great precautionary measure as well. So people are still shopping for the holiday, but it's limited for how many people. I noticed when I went to the Dutch market before Thanksgiving, and they were counting us coming in. I appreciate.
No, and that's good. And in the Jones Falls Farmers Market, they are also doing that. That is correct, and in a lot of other places. George May has another question about credit cards or cash when grocery shopping. I will tell you, my bias here is that in general, the transmission risk from cash is pretty low. You really, unless the person who's receiving the money is licking it, in which case, which usually doesn't happen, and I discourage it. The most important thing in this, but the principle here, and this is one of the things that I do want people to understand. When they're in the grocery store, there's a lot of people who are wiping down everything, and I get that. But the truth is, if the virus happens to be on your hand, it does not cause you illness. It is the hand to mouth, hand to nose, hand to face to eyes that is the risk. So the most important thing to do is not to ever touch anything. You don't even have to wear gloves. If you make it a rigorous practice to wash your hands after you've gone shopping, after you've handled money, whatever it is that you've done where you've come in contact with surfaces that other people might be touching, you can guaranteed prevent an infection by the simple act of washing your hands religiously before you eat, before you touch your face, before you do anything else.
Yeah, as I leave the store, I pull out that hand sanitizer and then walk in the house and go to the faucet and wash the hands.
And that will 100% protect you.
That's good. So we're winding down to the close of this summit. I really appreciate you all. I will give you opportunity to give final words from each of you as we wrap up. Thank you to all of those who have joined us tonight as well. Thank you for your questions and your interaction. Be sure to share it on your page. Tell everybody about it. Even after tonight's summit, it's going to live on all of our websites, so you can always go back and get all the information that we shared tonight again, and you can share it with other people too. Okay, so we'll give each of you an opportunity. We'll start with Dr. Clifford and give you, and then we'll go to Dr. Feldman and then to John Weinstein, and we'll give you guys final words at this time.
Sure. The only thing I'd say is, look, this has been tough on everybody. We all acknowledge that it has been tough. It's going to continue to be tough for a little while. But there is a spot on the other side of this where you, your family, your friends are all going to be over the worst of it. And the thing to remember is, as tough as it is to do now, there is another side to this. And what we need to do is really now, what the governor has said is right. Wear the mask, do the social distancing, wash your hands, look out for your friends and neighbors, and do those things. And we will get to the other side of this.
I agree. Dr. Feldman?
Yeah, well, first of all, thank you so much for this opportunity. I've really appreciated the conversation and the ability to share these important pieces of advice with your listeners. I think what I'd really like to emphasize is that with contact tracing, it is okay to share the names of people, your close contacts if a contact tracer calls. First of all, your name will always be kept confidential. When a contact tracer calls your close contacts, they won't reveal who it was that said you were a close contact. And the reason we're calling is to make sure you're okay. It's all very much to look out for you and your family and the community. So we ask people to participate with contact tracing. That might be a phone call that says MD COVID on it, and then to share the names. And as Cliff said, we will get to the other side, but it does take all of us. And so please cooperate with contact tracing, wear your masks, and have a really good holiday.
All right. John.
Well, my colleagues have said a lot that just makes a lot of sense and is really straight to the point. Cheryl, thank you for this great community service that you've done, not only for your listeners, but for the entire community to keep pushing this message. I'll just speak from my perspective of testing, and that is it's information you should use. If you have any reason to believe, whether you're symptomatic or been exposed, the test gives you information to take the appropriate actions. And you owe it to yourself, you owe it to your family and your friends to have that information and take the appropriate actions based on what you learn. So, especially if you learn that you're positive. So, as we're going into the holiday season, as Cliff said, this is a tough time of year for a lot of folks. It's even tougher for folks given the circumstances we're in right now. But by doing these simple things, we'll get through it. We'll be safer. And if you're not going to do it for yourself, do it for the people you love, and to be safe and to protect those around you.
Well, I really appreciate all of you for your candor. I thank you for your expertise. Thank you for breaking it down for us. So it's not just us here at the radio station telling you what to do, but we really are following the guidelines that the Maryland Department of Health has set in place for us, so that we can keep this the curve of COVID-19 down in the state of Maryland. Let's eradicate it. Let's just do
get rid of it.
Let's get rid of it, right? So thank you all so very much for your time.
Thank you, Cheryl.
Thank you for sharing. Thank you to our viewers for on all stations for checking it out today. Again, share to everybody about it. Go back to the website and listen to it again over and over again. But we appreciate you guys. Thank you so much. That's going to do it for us tonight. We appreciate you guys hanging out with us. Have a good night.
Have a good night.
Have a good night.
Holiday.
Happy holidays.
Thank you, Cheryl.
Listeners.